Hello, my name is Dr. Don Cohen. I'm Chief Clinical Officer at Health First, and we're going to be doing a series of webinars on some of the different emergencies that can occur in the medical office. Much of the material is taken to some extent from Dr. Stanley Malamud's textbook and goes on from there. So if I could, let's next. So in talking about diabetes, please note, we're going to talk first about what diabetes is like in the general patient population, the percentages, the incidence, and so on. How to get the right questions out there for your diabetic patient so you can help to avoid any kind of diabetic emergencies. The third area we would discuss is medical emergency case study. What happens? What do you do? What's appropriate? We've also included a quick guide to preventing medical emergencies, sort of as a leave behind. The goal here, of course, is prevention, and that's the ultimate point. This is about prevention. Next. So when we look at these numbers, these are gigundous. I mean, over 25% of adults over the age of 65 have frank diabetes. These are people who've been diagnosed with diabetes. That's incomprehensible, but it also means that you should be looking at your patients with a recognition that fully a quarter of those patients over 65 might very, very well be diabetic. Might be a good question to ask before you begin treatment if they don't have any place on there that they've checked their diabetics, to ask them when is the last time they had their blood sugar taken. Really, really important. And you can be doing a wonderful thing for your patients if you can aid them in getting an early diagnosis. And the reason I'm saying this, there's a very recent article in JAMA, which was actually excerpted in the New York Times yesterday, that an early diabetes onset, this is type 2 diabetes, an early onset could actually raise dementia risk. So if you take a patient who maybe has an early onset of 35 at age 35 or 40, just think about if those patients don't maintain good control, that can only exacerbate any of these conditions, leading on to, again, dementia. Really, really tough stuff. It's really important for us to recognize. And when you looked at that, sure, we got 26.8% of our population is diagnosed, and there's sort of like a guesstimate that another 7 million are not diagnosed. This is big time, and this is something we're going to see in our offices. Next. So when we looked at some of the other surveys that are done, the ADA, of course, has been involved in this. And this is where also Stanley Malamud comes in. And the reality here is that insulin shock is one of the key medical emergencies that we need to respond to. So how do we do this? Well, we've got to stay informed. And as you see, we have to be proactive. And of course, we want to reduce these occurrences. You're not going to be able to avoid them all, even with the right questions, no matter what you do. Next. So we're going to go through a series of questions here. But I'm gonna sort of remind people there was a TV program called House. Hugh Laurie was a prime doctor, and he was sort of an honorary dude. But one of his comments was, all patients lie. And the best example I can give you. So here we are, the typical questions that our front office would ask would be, did you eat this morning? And did you take your meds this morning? Patient says yes to both. Okay, let's take them back into hygiene and let's begin doing our thing. May not be enough information. Next. So let's expand on that a bit. If we want to ask a patient, did they eat? I think it's really important to find out, what did they eat? And then, is that normally what they eat? So going along with that, knowing when they ate, and going along the final piece, did they take their normal meds and normal dose at the normal time? So when you put all that together, I'll give you a scenario. There's Mrs. Smith, and Mrs. Smith has 8:30 appointment with a hygienist. Mrs. Smith normally eats everything bagels in the morning for breakfast. So a question for you, with an 8:30 appointment at the hygienist, do we really think that she ate an everything bagel with all the seeds and the onions and all the things prior to sitting in a chair with a hygienist who has already complained that her brushing and flossing leave a lot to be desired? So the odds are, I'm going to bet, she probably didn't have that bagel this morning and may not have had anything, but you asked me, I know I'm supposed to eat something, and there you go. Really important when we ask these questions, and it doesn't matter whether it's our front staff or anybody else in the office, maintain eye contact with the patient. Invariably, most patients, when they are not telling you the absolute truth or avoiding the situation, will not maintain full eye contact. Just a simple kind of thought. We need to look at our patients. And that goes to things as simple as, so your patient limped into the office. Would you not ask them, why do you have a limp? If the patient doesn't answer, you certainly know something's happening. Next. So we're not going to go through our entire medical history for every single patient, for every single visit. If you did that, you're going to wind up killing an extra 10, 15, 20 minutes for every single patient. On the other hand, some simple questions that you see on there, as far as any recent changes in your medical history or conditions. And sometimes I'll even put in there, have you visited a doctor? And then, of course, changed medication since your last dental visit. That question may not be effective. And the reason is, it depends when their last visit was. But a key part of that is, you saw the patient on Monday, they went to the doctor on Wednesday, and you saw them on Friday. Maybe the doc changed their dosage of med, or maybe even switched them from something like a metformin to an actual injection of insulin. So really important to get those questions out there. Look at your patients when you're asking the questions. Again, those are key pieces to follow up on. And of course, any kind of changes in vision, in tingling, numbness, and weight loss, those are all key indicators that their diabetes is not under control. And for all of us, we need to think about what happens when diabetes isn't under control in the dental office. Next. So you could ask the patient, what was your last glucometer reading? They may remember, they may not. They may not remember whether that was fasting or non-fasting, but what they will remember is, hey, please bring your glucometer with you, because we are going to test prior to your dental appointment to make sure that we keep you as safe as possible. It's important that you remind the patient to bring their glucometer. As we know, you would love to leave that on their message if you leave a message, but we know we can't do that. There's all kinds of HIPAA happy stuff in there that we can't do that. But one of the things we can do to make sure we get to the patient is, Mrs. Smith, it's imperative that you call the office before coming for your appointment tomorrow at noon or whatever time. By virtue of that, you have a good shot of someone in your office talking to the patient and reminding them to bring that. Next. So this is a case study that we put together. And this is one that sort of puts all the parts and pieces together. As you can see, the patient apparently came in the morning, real nervous, real fidgety. And this is a patient that they've been seeing for a while. So this is like out of the ordinary, or the magic abbreviation we put in the chart, WNL, within normal limits. This wasn't within normal limits. But the receptionist did her job, asked her about her medical history, if she ate this morning, changes, and so on. And Mrs. Jones said, no, all good. So then the hygienist brings the patient into the treatment room. And as she brings the patient into the treatment room, the patient becomes even more anxious. And you can almost see this. The patient's pleading to the hygienist, please hurry. So here's the patient. They step out of the room. And when she steps back in, the patient appears semi-conscious. So important. Here's a poll question. What do we think is happening to Mrs. Jones? Here's your question. Here are the options given. And we're going to do this fairly quickly, but you can see they're all pretty common sense things. Some of them not as much. Next. So, do we think that the patient passed out? They fainted? Probably not. So let's go and let's move on from that and let's go over these answers. So, do you think she probably fainted? Well, she was nervous as heck before. She's anxious. I question that she really fell asleep or fainted. Either one just doesn't make sense. She may not have slept well last night, but I don't see how that's going to exacerbate the nervousness or anything else. If anything, she's going to be more lethargic because of that. So now let's get down to blood sugar. What do you see if a patient is hyperglycemic? In other words, increased blood sugar. Well, if you're looking at a patient with increased blood sugar, they probably will be maybe a little lethargic. They may be a little flushed. At times, these people on the outside, not in your office, have even been accused of being drunk under the influence. But whatever it is, you're not going to see them be pallid and just basically crashing. When you see that, you must immediately suspect hypoglycemia. Now, how could you avoid that? Well, maybe if you had the patient bring their glucometer and tested them, you would have a pretty good idea that their blood sugar was pretty low. So we need to think again why the steps that we're talking about are so very, very crucial. A hypoglycemic patient can go south, meaning literally up to and including diabetic coma and death in much less time than you could imagine. And it's the reason we need to be prepared for that event. What would happen if you took, I'm just going to hold 1 second. We're going to stick on that for just 1 second, and we're going to talk about hyperglycemia. What would happen if you gave a hyperglycemic patient a little bit more sugar? They had, I don't know, a glass of juice. The reality is probably nothing. Because once your blood sugar is extremely high, Another 50 grams of sugar, another 80 grams of sugar, in general, is not going to do very much. And you may not even notice a difference. Next. So now let's have a poll question again. What is the appropriate medical response for this? Again, we'll go pretty quickly through this, and then we'll review after. Everybody should have had a chance by now to respond. Let's look at what the results are. So, notice what was chosen. As we look at this, and we look at what was done, should you activate the office response team? Well, I'm going to say that if I see a patient who was talking, was conscious, and all of a sudden is slumped in the chair, no matter what I do, I'm going to activate our office response team. And that's going to be a whole long list of things up to and including a plan. And the plan is not going to be based upon someone's name, but on the position. So that regardless of what day it is, who's in, who's not in, there will always be a receptionist, there will always be 1 or 2 dental assistants. We're going to rely on that. So we would definitely activate that plan. What about retrieving the medical emergency kit? Well, this patient all of a sudden is not with it. So without a doubt, we may need to take something from that kit. With the patient having a history of diabetes, you not having a handle on it because we didn't use the glucometer, the safest thing to do is always administer some glucose. So in your emergency medical kit, you have a tube of instant glucose. And the neat thing on that is, and we just talked about this before, even if the patient was hyperglycemic and you added a little more glucose, nothing's going to happen negative. On the other hand, if they were hypoglycemic, you might see that patient start to blink their eyes right away and start to come around. So always, always, always feel comfortable administering additional glucose. When it comes to calling 911, you see the wording there depending on patient response. But even more important, anytime you are uncomfortable with a patient, anytime you're uncomfortable with a patient in terms of your level of control of the medical response that you may need to initiate and the condition that they're presenting in, always call 911. If you are comfortable and you said, okay, I'm going to wait a minute or two and administer some glucose, if you're comfortable doing that, that's a great idea. But whatever it is, never ever be embarrassed to call 911, because you could think of the embarrassment it might be if you didn't and something untoward happened that you could have avoided and addressed. Next. So we created a quick guide for you, sort of like a leave behind. And it's sort of the questions to ask, reviewing the medical condition, and of course, going again about the glucometer. Really, really, really important. And when we look at some of the target levels, you can see, obviously, we're looking at 100 as the top line for fasting, up to 130 before a meal, and after a meal for these patients, it can even go up to 180. Remember, they do not have good control of their blood sugar. And it's the reason why they are either taking some meds, they're utilizing actual injections of insulin. And of course, these people have to be very cautious of their diet and their intake of carbohydrates. These are the kind of situations we need to respond to and we need to be comfortable with. This stuff happens, or as Stanley Malamed would say, this is not and if, it's when it's going to happen, and will happen to all of us at some point. Now, please, please, please recognize all questions are valid. There are no silly questions. We've all heard that when we went to school. Please, please, if you have any questions to ask, really important that you reach out with them. And that's the purpose of this. Next. So remember who we are. We're physicians of the oral cavity. The connection between oral health and systemic health is total. It's who we are. It's important that we know what's happening and that we are absolutely comfortable knowing responses we should be doing. The only way that's going to happen is with practicing and drills. And the drills have to not be once a year, has to be more frequent. I've even seen offices where they bring in somebody's relative and they appear to be having an incident in the reception area, maybe even wearing a bracelet that says I'm a diabetic. And now, okay, what do we do? Holy cow. Interesting seeing the sweat form on many people's brows at that point. On the other hand, that's a real drill. Next. Please, with any questions, anywhere, anyhow, do not hesitate to reach out to us. Our team at customer service is always there for you as well. You have our 800 number. You have my email address. Please, one of the advantages we have at Health First is we have a phenomenal medical advisory board with some super docs on it, medical and dental, up to and including Dr. Stanley Malamet is on our medical advisory board. If you have any kind of questions and we can't help you with them, we'd be glad to reach out to our medical advisory board and they will respond to your questions. I have to thank you for your attention, and please look forward to some more discussions on some other conditions that we need to take into account. Think of things like hypertension, COPD. We will be reaching out on those in the near future. Thank you again for your attention.